Forecasts vary based on assumptions about where healthcare providers would set prices. Administrative savings that could be made, lower cost of medications and changes in healthcare use, said Sara Collins, PhD, Elizabeth Warren, psychic, my first long-term plan to reduce healthcare costs in the United States and the transition to Medicare for all, November. The calculations make assumptions about the years the plan will be in place, its effectiveness, and the savings from federal government coverage of all healthcare expenditures. Medicare for all would reduce the paperwork for healthcare professionals and reduce the cost of medicines in hospitals, says Berwick, Kaiser Family Foundation fact sheet. Americans' challenges with healthcare costs. June 11, 2019. All Americans would have coverage for comprehensive health services, including hospital stays, emergency consultations, medical visits, treatment of drug-related disorders, dental, vision and mental health services, long-term care and reproductive health care. The plan is based on Medicare, the popular national health insurance program for Americans over the age of 65 and for young people with disabilities. Currently, federal, state and local governments spend just under half of all healthcare costs through Medicare, Medicaid, CHIP and other expenditures. According to the Affordable Care Act, about 20 million newly insured Americans have entered the healthcare system, but long waiting times for doctors have not been reported. Collins said, the country would end up with a healthcare system, said Donald Berwick, President Emeritus of the Institute for Healthcare Improvement, a Boston-based nonprofit organization, and an unfortunate restructuring of the federal government to spend billions of dollars on additional spending would lead to unpredictable disruptions of the healthcare system. Opponents said, changing the funding of all health services through a new tax on employers, employees and high-income earners could also slow the economy and not be enough to pay for all new federal spending. A public option is health insurance, which is funded and managed by the federal government, but which would compete with private health insurers in the commercial market. Kaiser Family Foundation. How much do Medicare beneficiaries spend on healthcare out of their own pockets? Millions of people will no longer have to choose between healthcare and other needs such as food, warmth and shelter, said Sanders in a statement describing his proposal.